Hernias happen for a reason, and emergent surgery is one of them. Weight is another big part of it. There are so many reasons for it, but I need to make sure that the patient is ready for surgery. So it's not just a technical feat. It's not that robotic surgery, open surgery just fixes you. You really need to make sure that the foundation is there for the patient. So it's key for our center, right, to make sure that we minimize complications. And how do we do that? Smoking cessation is very, very important. The metaphor that I use is like having a sprinkler system. You want to keep your lawn green, right? But then if you smoke, you're literally putting gravel in the sprinkler system. It will not work. So smoking is extremely important. Nutrition management is extremely important, right? The weight will put pressure on the repair. So no matter what good repair you get, the pressure may disrupt it no matter what, and we can't keep doing the same thing over and over. And nutrition from the other side. Sometimes patients are very depleted, they're very malnourished because they've been through emergency surgery and other problems. So I need to make sure that actually they're safe enough, that they're strong enough to sustain surgery. And then mobility. Somebody cannot really walk, cannot really take care of themselves. That's very hard because they won't be able to heal. So it's a 360-degree care that we need to make sure we provide. We're not just technical surgeons, to make sure that we improve the outcomes and give a repair that can be sustained over time.